From time to time, there are going to be disputes about whether particular services should be included in a member's plan. And the question is, how do we resolve those? The answer is, the family care system has a very specific decision-making model called the Resource Allocation Decision Process, or the RAD. The RAD is a step-by-step process. The idea is that the care management team will go through it piece by piece and look at whether a particular service is necessary for a member's outcomes, whether the service can be changed in some way, or even whether the service can be terminated. The step-by-step process is extremely important because the member should be able to say, I have this need, the service we're talking about helps me meet a particular outcome, and the care management team and anybody who's suggesting that the service be cut should explain very specifically why the service may or may not be important and whether there are other alternatives. Speaking of alternatives, it's important for a member to consider those very carefully because there are going to be situations in which the care managers come up with an idea for a different service or changing how a service is provided, and if that's going to help the member meet their family care outcomes and there are no negative reasons, well then the member should certainly go along with that. The question is whether it's a slight change that's not going to make a big difference to the outcomes that the person is pursuing, or whether it will be a big change. It is really important to remember that the purpose of the RAD is not to cut services or find the cheapest service. The purpose of the RAD is to identify cost-effective services. There may be some very expensive service that is still appropriate for the person because they have very specific needs and this is the only way to meet those needs. Other services may be less expensive and can be delivered in a more effective way, but once again, the RAD says specifically that it is not just designed to find the cheapest services. We need to look at effectiveness. The decision of where a member lives is a very special team decision. Any service is important, of course, and how a person receives personal care services or the things they do with their day can be very important to a person. The issue is that where a person lives is so important because moves can be traumatic to any person and especially to people with disabilities. That is why the family care system requires that any decisions that could result in a person moving from their residence be done very carefully and using a special process. The care management team is required to look at virtually every option that could be used to maintain the person in the residence of their choice before making a decision to move. And there are special requirements for notifying the member about a potential decision to move.